Hello, everyone, and welcome to the very first episode of the Rogue Health Economist live cast. I'm your host, James Maskell, and every weekday at 12 o'clock Pacific, 3 o'clock Eastern, until the end of the California lockdown, I'll be coming live talking to you about all things health economics and my particular viewpoint on it. I'm super excited to be doing this. Feel like it's a good use of my time here in lockdown, and I hope that we'll be able to share some really incredible concepts, interview some great people, bring some ideas that are, you know, maybe not exactly in the mainstream, but ideas that we think can have a big impact on the future of healthcare in this country and all around the world. So my name's James Maskell, and I'll be sharing a little bit today, just a little bit about who I am and how I got here and how the Rogue Health Economist came about. But in the future weeks, we'll be talking about different concepts to do with health economics, how they're super relevant right now. We will also be going deep into other topics with special guests. We're going to have a trauma week. We're going to have a community week. We're going to have an autoimmune disease week. And that's just getting started. So buckle up. We are going to go places that, that maybe have not gone in traditional conversations. And I'm super excited to be here with you. So let's just kick it off. I'm going to share my screen here and I'm going to show you. Ultimately, I've been involved in health for the last 15 years. But before that, I moved to America 15 years ago. But before that, I did a degree in health economics. So I went to the University of Nottingham and I had some great teachers there. And during my time, I started to see graphs like this, right? If you look, I was at university between like 2000 and 2003. That is pretty much this part here where there's an exponential curve upwards of healthcare spending, an exponential curve of healthcare spending in the UK, right? And, you know, the sort of example that we would joke about as far as like where health economics was going completely pear-shaped was in America. So in America, you know, this is probably a familiar graph to most of you that over the last 60 years, you know, healthcare costs have gone up so dramatically. Now, the thing to know as we get into this, like I grew up in the UK, you can probably tell from my accent, but I was born in Colorado. And so, you know, there's a lot of conversation out in the population and in the media about, you know, single payer, can Medicare for all save us? Like if we just move to Medicare for all, would it control healthcare costs? And I think you can see that, like, you know, the Medicare for all that's being proposed is not really Medicare for all. It's a single payer system, which is what the UK has. And the UK has this curve, right? So it's obviously that whoever's paying for healthcare, you know, and, whoever's paying the bill, it might have some effect, but it's certainly not going to solve the problem, because if it did, the NHS would already have flattened the curve. And, you know, when this whole flattening the curve thing started to come out with regard to COVID, I just started to think to myself, like, I think we're ready now to start to have a conversation about what flattening the curve might look like in healthcare in general. And so, you know, this podcast is really dedicated to flattening the curve of healthcare costs. What would it take to flatten these curves, to create, you know, a situation where healthcare looks a lot more like Moore's Law, where cost comes down exponentially, right? Because it's so damn efficient. Like we've seen that in technology, we've seen that in all these other areas. Why does it keep going up in healthcare? So 15 years ago, I moved to America to try and work this out. And my first job, I worked in a clinic in rural Georgia, and I started to see what the cause was. It's chronic disease, right? It's chronic disease. So whatever stats you want to look at, 6 in 10 adults have a chronic disease. 4 in 10 adults have 2 or more. You know, you must be familiar with heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes disease, chronic kidney disease. I'll also throw into this autoimmune disease, right? It doesn't get as much hype, mainly just because of the naming conventions, right? They're all called different things, but if you conglomerate all of the autoimmune disease like rheumatoid arthritis, multiple sclerosis, colitis, Crohn's, if you put them all into one category, it's a huge impact. And the drugs are unbelievably expensive, right? These drugs for autoimmune disease cost so much. So we have chronic disease. Now, what I saw when I started working in that clinic which was my first education, which was run by a registered dietitian / naturopathic doctor, is I saw people reverse their chronic disease. I saw people who had one of these diseases right in front of you, or worse, or coming in a walker, or coming in a wheelchair, like in a period of time, not in a week, not in necessarily a month, but in 3 to 6 months, have dramatic transformations in their health outcomes, dramatic changes, right? So it seemed what these people were really getting was self-efficacy, right? And independence from the medical system. And I was like, this has to be part of the future, because if you have the majority of Americans or the majority of British people on lifetime dependence of medication, there's only one direction that this, that this cost curve can go, and it's impossible to bring it down. Chronic disease gets more, the cost of treating and managing chronic disease gets more, but I saw patients who were getting better, getting off their medication, and essentially just becoming well. Maybe they needed to take a few supplements here or there. Maybe they needed to maintain the healthy behaviors that they were learning. But ultimately, they were independent of the medical system and not costing the system anything anymore. So that was my first hint. I was like, okay, this is part of the solution. And from there, I took a job. Now I was like working with these kinds of practitioners. That was a N=1 experience that I was having with this new type of medicine. And I wanted to see how else it was being done. So I took a job as a sales rep. My territory was from Virginia to Maine, and I was selling to these doctors. And over the next 3 years, I put 100,000 miles on my car to try and work out what's going on here. Like, how are people reversing chronic disease? What's the plan? Now, for those of you who know me and know my story, that turned into really realizing that I had a strength in practice management and helping doctors sort of align to this new reality, right? When you start, if you're a primary care doc and you suddenly decide that you want to do this new operating system of medicine, what does that look like? You have to have someone who's going to help people be accountable to their lifestyle and behaviors, right? Everyone in the world has a list of things that they already know that they should be doing that they're not doing. And so, how are we just going to add more stuff on there, or we're going to help people work that out? So that's the first thing. Second thing is, how do we organize people? Like, this can't really be done on insurance, because to get to the root cause of whatever condition you're working with and to really understand what the etiology of this condition was, it takes some time, and you can't do it in a 99213 15-minute visit. It's impossible. And so what were the structures to be able to deliver this? It was also about the time that the internet was becoming, really usable. And so how were practices using the internet for education, all these kind of things? And I had a chance to speak in front of doctors, in front of primary care doctors, learn about the industry and speak at conferences. And from that position, I kind of realized that I had some significant advantages. I knew how to make jokes that doctors would laugh at. And I knew that I could, to make an impact. So ultimately, you might be asking, well, is this a health economist or is this a rogue health economist? And ultimately, I guess I just want to share that the thing about me that's rogue is that I'm not an academic, right? The end of my formal education was a Bachelor in Science with honors from the University of Nottingham in 2003. The reason why I feel like I'm a rogue health economist is because I've spent the last 10 years building companies and doing experiments to try and work out what's going on. And then, starting to really understand that. So right from the beginning, taking that job and then starting to move into, starting to express my own ideas about how we could actually solve this problem. And, I would say that for many of those, for some of that time, I was actually, I would say kind of like I was angry, right? I was angry that this was happening, and I was angry that more people weren't paying attention to this kind of medicine, these kind of doctors. And ultimately, I came across a quote around that time that really inspired me, which was from Bucky Fuller. And he says, "You never change things by fighting the existing reality. To change something, build the new model that makes the existing model obsolete." And if you've engaged with me at all over the last 6 years, since I read this quote has been on the bottom of my email. And I can't tell you how many times that people who have written back to me the very first time I reached out to them said, "I love that quote. That's what I'm all about." Those people have been my strongest allies over the last 6 years in building what we've built. So what have we built? So in 2014, we started a show called The Functional Forum. It was our attempt to prioritize and to make it much easier for doctors to learn about functional medicine. You know, why functional medicine? The original clinic that I worked in wasn't functional medicine. It was really like naturopathic integrated medicine. Well, when I started going to conferences and saw the functional medicine matrix, I realized that there was a structure, a common language for practitioners to agree upon. And my goal was to be able to scale this, right? To be able to scale this type of care to every American and everyone around the world. So you need to have a repeatable system. Naturopathic medicine, integrated medicine, the principles are bang on, but it's artistry, right? It's each doctor is doing it slightly differently, and they're all, you know, they're artists doing things in a new way, which is amazing, but it just doesn't help with a scalable solution. So I found functional medicine. I had heard Dr. Jeffrey Bland lecture in 2010 at a conference, and I was like, hang on a minute. This seems like MDs, physicians, primary care, even, you know, even specialists are getting this and they like it and they're listening. And I was like, okay, this is good. And then a few years later, I saw Dr. Christy Hughes give a talk, and I saw the functional medicine matrix. I saw the system. Now, later this week, I'm going to do a whole episode on the functional medicine matrix, because I believe that the functional medicine matrix is not only a common language, but a system for maximizing marginal benefit on delivery of care and prioritizing which benefit and which solution from the bag of integrative tricks will make the most impact for the person sitting right in front of you. That's how I view the functional medicine matrix. And later this week, I think on Thursday or maybe on Wednesday, watch this space, I'll be taking you through the functional medicine matrix, what it is, how it works, and why I think it is, and why I've based everything that I've done on the functional medicine. So we started this show called the Functional Forum, and it grew. Right, we've done an episode every month for the last 6 years or more, done over 76 episodes, I think now. And we built meetup groups of physicians who watch the show all around the world. It started in New York, and now it's grown all over the world to be able to be a place where doctors can come together and learn about functional medicine. We called the company The Evolution of Medicine, because it was medicine just adapting to its new environment. And in 2016, I wrote my first book called The Evolution of Medicine. And the goal of that book was, if I gave it to a doctor and they read it, at the end of it, would they be, one, wanting to start a functional medicine practice, and two, would they build this new model of practice that we had seen that was really easy for doctors to take on, which is a low overhead, digital first practice. Now, it wasn't really my intention, but that model of the low overhead digitally integrated practice has actually proved to be somewhat visionary in the time of COVID, because ultimately it's really the only practice that's been able to survive because of the low overhead and the strong digital presence. Like those doctors who followed the book and came into our practice accelerator, who built these kind of practices, are thriving today, whereas the majority of primary care and functional medicine is currently furloughed. So that was the first book. And I just take a moment now to, one of the sponsors of the show is The Evolution of Medicine. It's one of the companies that I started, and we released last week a virtual practice pivot interactive guide. It's totally free. It's one of the best things we've ever made. If you go to goevomed.com/pivot, if you're a health professional, you play any other role in healthcare, get the guide and you can see how you can be actually helping people today with a virtual clinic. But what are we going to do? What kind of healthcare are we going to deliver, and why? And I want to just take you into a clip that I saw last week that I think really showcases the fact that modern medicine, or Western medicine, is losing confidence in itself and realizing that it's not as great as it thinks it is. And if there's one guy who sort of personifies that for me, it's a guy called ZDogg MD. And this guy has built a huge following. I think he gets so much of healthcare right. I think there's a little parts of things that he gets wrong. But he did this epic rant the other day that I want to put in for all of you to look at, because I think it encapsulates so much about mainstream medicine coming round to the fact of what their medicine does, what it can't do, and why functional medicine is the solution for the future of care. Check it out.
Can I be really frank for a second? We always talk about how American healthcare has the worst outcomes for the most money. Why is that? Is it because we don't have good doctors? Nope. Is it because we don't have good nurses? Nope. Is it because we don't have good technology? Nope. Is it because we don't do a lot of care? Nope. We do a lot of care. We do a lot more care than the rest of the world. But then look at the outcomes in, say, Europe or the rest of the developed world and see how much better they are. And then wonder, why is that? If you're being honest, it's not because they have better healthcare. It's not because they have better access to healthcare. It's because they do less healthcare. It's because they are forced to ration healthcare, as we do in this country, but it's different. They're forced to ration healthcare, which means they're forced to ration something that doesn't often work, that makes people worse, and it sucks money from the parts of spending or of our economy that actually would help people. Job development, education, food security, stopping the cycle of physical and sexual and mental abuse. These are the things that we should be spending our hard-earned money on in this country. Instead, we pour it into a sinking morass, a black hole, a singularity beyond which nothing escapes, called healthcare. And now COVID comes along. So what do? We weaponize our healthcare system even more to fight this threat, which, if you look at it in the grand statistics of death in this country, it is a blip. Now, again, I'm losing my mind a little bit here, but I mean every flippin' word I say, you guys. And I'm a doctor. I was trained in this system. I take care of patients in this system. This is truly what I believe. Stay away from healthcare if you want to live a long and healthy life. Work on your diet and your nutrition and your mental health and your connections. Sleep more, walk more, connect more. That's what we need to do.
If you follow functional medicine, if you're in this world, that was a huge moment. Huge moment. All of the stuff that we've been saying forever. Healthcare doesn't really help anyone get healthy, right? This is what we've been talking about for years. And now the voice of the mainstream is saying it. Now, Z-Dog's had an interesting time. You know, a few years ago, he was totally against anything functional medicine. Then he had a doc on the show that started talking about IV vitamin C for sepsis, and it kind of like messed with his mind a little bit. And now, ladies and gentlemen, he is going full functional by the sounds of it. What did he say at the end there? These are the things that actually create health. How you eat, how you exercise, how you sleep, how you take care of your stress, and how you connect with others. And watching him and his mind shift change over the last few weeks has been amazing, because I feel like he is the perfect example of like mainstream thought and representation of mainstream doctors and the way they're thinking. So the future is functional, my friends. And why is the future functional? Because the bottom of the functional medicine matrix, this operating system for the future of care, that's literally the 5 things that are at the bottom. You get a score out of 10 in those 5 areas: food, exercise, sleep, stress, and relationships. There's a lot more to the functional medicine operating system, and you will see it later this week. But I had to show you guys that because I feel like the world is coming around to our side. And I feel like, you know, we're really starting to see that what people have been saying in the functional medicine space, in the integrated space, in the naturopathic space for years is becoming the future. So let's take this and talk a little bit about COVID, because that's what's going on right now, right? How does this apply to COVID? What do we need to know? So I was on a webinar last week with the Personalized Lifestyle Medicine Institute. Dr. Bland is the founder. And one of the speakers, Dr. Ari Vojdani, shared this slide. And I shared this slide and people went nuts for it, because no one has been really able to say, like, what causes people to get sick? Like, everyone gets this bug. You see, 80% of people are asymptomatic. You saw the Stanford study and the in the study in LA showing that way more people have been infected than we thought, because we just started to test asymptomatic people right from the beginning. All the smart people were saying, look, we have no idea what the death rate is because we're only testing those people who are showing up in the hospital. Right? Once we start testing just random population, that's when we're really going to know what this virus does. And what we're starting to see now is that, you know, it could be anywhere 80% plus of people have absolutely no infection, no result. They don't even know they got it, right? And then some people get a mild infection and some people get a serious infection. Now, this slide really showcases through the eyes of an immunologist what's happening, right? So the viral droplets come in, they go to the eyes, nose, and mouth. That's why we don't touch our eyes. And then it starts to go to the viral barriers, okay? And what I want to take you through is what all of these 6 things mean. And ultimately, you can understand now, what do we do? Because the truth is, what functional medicine does is essentially understand the level at which these viral barriers are functioning, right? You can give yourself a score between 100, which is like perfect health, and maybe at 30, right, you start to have some symptoms, and there's a gap between 30 and 100, and that is functional medicine, right? It's measuring that function. So what are these things? Exposome, that is the lifetime exposure to everything that you come in contact with, right? And that can be transgenerational as well. So if you're the daughter of a coal miner, or if you're the, you can see if you're the son or the grandson of someone that we sprayed with Agent Orange in Vietnam and you have a birth defect, that's because of the exposome of 2 generations back. That's an obvious case, right? But there are more subtle gradations of exposure to toxins. And how people's exposure to toxins affects their infection may explain some of the patterns of infection and different numbers across the country. Mucosal immunity. When I started in this field, leaky gut was a fringe term only used by quacks. And now it is mainstream gastroenterology, my friends. Mucosal immunity is the quality of the gut tube, the hole that goes from your mouth to your asshole. Like that tube, and what is the, what is the integrity of that tube all the way through the body? You can see here, if it's strong, if your exposome is low, if your mucosal immunity is strong, if you have strong neutralizing antibodies, if you have healthy viral receptors, if you have a strong innate immune response, and you have strong anti-inflammatory cytokines, you get COVID and nothing happens, right? You're just healthy. If some of that dysfunction is there, you get an infection. And if all of those things are out, you get a serious infection or you die. That's why old people die, because these things do break down over time, right? It's not uniform across the whole life, but these things do break down over time. So ultimately, that's why functional medicine is so important, because we can see the degree to which these things break down over time, and we can improve the function, right? There are proven ways to showcase how we can improve the function of all of those things. That's why functional medicine and its outcomes from the Cleveland Clinic was showcased in JAMA in October 2019. So what do we need? We need everyone to have access to functional medicine, right? We need everyone to start working on, their mucosal immunity and those 5 fundamentals that ZDogg talked about. And so over the last 6 years, but really the last 10 years, I've been involved in trying to inspire and empower doctors to participate in creating function in their populations. And we've done okay, right? We've got a lot more doctors doing functional medicine. There's 1 in every town now, but we still have problems with access and affordability. And later this week, we are going to be making a massive announcement about a new project. I'm the rogue health economist. I'm not sitting back and telling people what to do. I'm not an academic. I'm not someone that is just sitting on the sidelines saying, hey, this is what we should do. I'm doing it. And later this week, you will see an opportunity for everyone, no matter their lifestyle, no matter the way that, let me just talk about the word lifestyle for a minute. You're going to hear a lot of things saying is COVID a lifestyle disease, right? And share this. If you know what's coming, I want you to share this. Yes, it's a lifestyle disease in the fact that people with bad lifestyles get worse outcomes. That is definitely true. But why do people have bad lifestyles? Is it all because people are lazy? Definitely not, right? We have an unhealthy environment in this country, in Canada, in all the health, in all of these, all these places where look at those 5 things. Do we have bad food? Yes, most people live in food deserts. 2, do we have stressful lives? Absolutely. 3, is our sleep impaired? 4, are we exercising enough? 97.3% of people are not doing those healthy behaviors. And the 5th one, isolation, we're all in our own houses. I haven't given a hug to anyone that isn't part of my direct family for a month. And it's kind of getting to me. And I know I just wrote a book. My second book, The Community Cure, was exactly on the power of community to transform health. So ultimately, these are the kind of conversations that we want to have, and to start to bring a different look at, you know, what it might look like to be able to, you know, to be able to look at a different way of focusing in on things. And this came out today. My buddy Asim Malhotra in the UK, this is in the Telegraph. Is it time for an honest conversation about weight? Right? We're going down the route right now of everyone having to have like some sort of vaccine certificate, either implanted or not, you know, or in a book that shows you have immunity. Well, look, if we know that those people, you know, having immunity is not really the thing. Are you infectious? Right? And do you get an infection? And so, you know, I love this. This is in today in the Daily Telegraph. Is it time for an honest conversation about weight? Because ultimately, we have seen that, you know, the worst outcomes and the death is mainly coming from people with serious metabolic disturbance. And so ultimately, you know, we all know what we need, right? We need a dramatically more resilient population, individual resilience, right? Family resilience, community resilience, national resilience, international resilience. If you believe that there are going to be more pandemics on the way because of climate change and that kind of thing, the vaccine is pointless because there's going to be another germ next year that does that. If you believe that to be true, right? One, vaccines don't work as well in people with metabolic disturbances. That is a fact. Two, we're just waiting for another thing to come along and we're all going to be stuck inside again. And there are quadrillions of viruses all along. Next week, we're going to have Dr. Zach Bush on the show, and he's going to share how many microbes in the air, how many in the soil, how many in the sea. We can't escape microbes. We may have thought 20 years ago we could, but the Human Microbiome Project showed they're all around us. The majority of microbes, bacteria, fungi, these are benevolent, right? We need these for our digestion, immunity, and metabolism. So to think that we can incubate ourselves from viruses is insane. So we're going to have that conversation here too. We're going to talk about how do we get functional medicine to have an impact at a population level. There's going to be so much good stuff coming on the Rogue Health Economist. I really appreciate you being here. Please share this, right? Share this. Like, I don't know if they're going to put me on CNN. Probably not, right? I don't know if they're going to put me on these other platforms. If you think that this conversation is useful and valuable and you want this conversation to get out, you can literally control whether that happens or not by sharing this on social media and getting your friends to share it. You who are watching this right now can decide if you want this kind of conversation to go bigger. James Maskell, the Rogue Health Economist on Facebook, is where this conversation is going to be happening for the next little while. And, you know, I'm going to do this every day until the California lockdown ends, Monday to Friday. I'd love for you to join us. I'd love many more people to get involved in this conversation. As I said, later this week, we are going to have an epic announcement about a way to bring affordable, accessible functional medicine to whole populations. I hope you'll keep joining us. Thank you so much for being part of the conversation today. I am James Maskell, the Rogue Health Economist. The daily live cast is Monday to Friday, 12 till 3 p.m. Tomorrow, we are going to be talking about a topic in medicine and a topic in economics that really got me thinking at the beginning. We're going to talk about negative externalities. Pollution is a classic example, right? An externality is a cost that is not borne by society of a particular interaction. So we create pollution, and that creates costs for society down the road. What type of costs? Maybe exponential increases in medical costs. We'll get back to that tomorrow. Thank you so much for tuning in. It's been a pleasure to be here on the first episode of the Rogue Health Economist. Thanks so much for listening, and we'll see you next time.